According to the American Heart Association, nearly half of U.S. adults have high blood pressure, also known as hypertension. High blood pressure is a risk factor for heart conditions, and if it's uncontrolled, it can damage your body and lead to complications. Results of high blood pressure include arterial damage, aneurysm, heart failure, blocked or ruptured blood vessels, reduced kidney function, vision loss, loss of cognitive function, concentration, memory and ability to learn. Metabolic syndrome, a cluster of metabolic disorders such as high cholesterol and insulin, atherosclerosis and increased waist size. Top 10 natural remedies for high blood pressure. Lose excess weight. Weight and blood pressure go hand in hand. According to the Mayo Clinic, losing just 10 pounds, 4.5 kilograms, can help lower your blood pressure. It's not just the number on your scale that matters. Watching your waistline is also critical for controlling blood pressure. The extra fat around your waist, known as visceral fat, is troublesome because it tends to surround various organs in the abdomen. This can lead to serious health problems, including high blood pressure. In general, men should keep their waist measurement to less than 40 inches. Women should aim for less than 35 inches. Nicotine addiction. Each cigarette you smoke temporarily raises blood pressure for several minutes after you finish. If you're a heavy smoker, your blood pressure can stay elevated for extended periods of time. People with high blood pressure who smoke are at greater risk for developing dangerously high blood pressure, heart attack, and stroke. Even secondhand smoke can put you at increased risk for high blood pressure and heart disease. Quitting smoking can help your blood pressure return to normal. Limit alcohol. Drinking a glass of red wine with your dinner is perfectly fine. It might even offer heart health benefits when done in moderation. Drinking excessive amounts of alcohol, however, can lead to numerous health issues, including high blood pressure. Excessive drinking can also reduce the effectiveness of certain blood pressure medications. What does drinking in moderation mean? The American Heart Association recommends that men limit their consumption to 2 alcoholic drinks per day. Women should limit their intake to 1 alcoholic drink per day. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. Increase your activity level and exercise more. Exercising 30 to 60 minutes a day is an important part of healthy living. Along with helping lower blood pressure, regular physical activity benefits your mood, strength, and balance, and it decreases your risk of diabetes and other types of heart disease. If you've been inactive for a while, talk to your doctor about a safe exercise routine. Start out slowly and then gradually pick up the pace and frequency of your workouts. Take your workout outside. Go for a hike, jog, or swim, and still reap the benefits. Eat less sodium and more potassium. Cutting back on salt and increasing your potassium intake can lower your blood pressure. Potassium is a double winner. It lessens the effect of salt in your system, and also eases tension in your blood vessels. It's easy to increase your intake of potassium, so many foods are naturally high in potassium. Here are a few. Dairy foods, milk, yogurt. Fish. Fruits, bananas, apricots, oranges. Vegetables, sweet potato, tomato, greens, spinach. Some people are salt sensitive. A higher salt intake increases their blood pressure. Others are salt insensitive. They can have a high salt intake, and excrete it in their urine without raising their blood pressure. Eat a healthy diet. Eating a diet that is rich in whole grains, fruits, vegetables and low-fat dairy products and skips on saturated fat and cholesterol can lower your blood pressure if you have high blood pressure. This eating plan is known as the Dietary Approaches to Stop Hypertension Diet. Reduce your stress. Chronic stress may contribute to high blood pressure. More research is needed to determine the effects of chronic stress on blood pressure. Occasional stress also can contribute to high blood pressure if you react to stress by eating unhealthy food, drinking alcohol or smoking. Take some time to think about what causes you to feel stressed, such as work, family, finances or illness. Once you know what's causing your stress, consider how you can eliminate or reduce stress. Garlic. Garlic may have the ability to lower your blood pressure by helping to increase a substance in the body known as nitric oxide, which can cause your blood vessels to relax and dilate. This lets blood flow more freely and reduces blood pressure. You can add fresh garlic to a number of your favorite recipes. If the flavor is just too strong for you, roast the garlic first. And if you simply can't eat the stuff, you can get garlic in supplement form. Ginger. Ginger may help control blood pressure. Ginger improves blood circulation and relax the muscles surrounding blood vessels, lowering blood pressure. Human studies so far have been inconclusive. Commonly used in Asian foods, ginger is a versatile ingredient that can also be added to sweets or beverages. Chop, mince, or grate fresh ginger into stir-fries, soups, and noodle or vegetable dishes, or add it to desserts or tea for a refreshing taste.
Yoga. Yoga involves breathing control, posture, and meditation techniques. It can also be effective in reducing stress and blood pressure. A 2013 review of 17 studies of yoga and blood pressure found an average blood pressure decrease of 3.62 to 4.17 millimeters of mercury. Some types of yoga were nearly twice as effective as the average.